definitely why Dr. Verma was so happy at that moment, because he was able to arrange a training workshop for our faculty as well as students, interns in this particular case, on a very, very important topic, and that too from a person who is authority on this topic. Dr. Yatin Swinkels is a palm expert from Netherlands, and he has very vast knowledge about dairy herd management as well as mastitis. Something special about this particular training is this workshop training is that it has been planned in such a way that the trainees will be spending maximum time at the farms and will get a first-hand exposure, first-hand knowledge about mastitis, about other conditions of the farm, and also get involved in interactive discussions with a super specialist. Dr. Verma ji will be telling you more about Dr. Swinkle and the training workshop details, and definitely how it is going to help the Punjab dairy owners. On behalf of the management of this prestigious institute, I welcome you all to this session of the workshop. I welcome Dr. Yatin and this elite gathering of learned veterinarians from State Animal Husbandry Department, from our sister colleges of Ludhiana and Rampura Phul, my dear interns, final year students, our college faculty members. I also welcome and congratulate Dr. Verma and his training workshop team. I hope this exercise will be fruitful. Thank you very much.
Thank you, sir, for the insight. May I have a pleasure to welcome our principal, sir, Dr. H.T. Verma, the former Director of Extension Education, Guru Angad Dev Veterinary and Animal Science University, for welcome address, and to provide the insight of highlights of ongoing 12 days training program, the theme of the workshop, and the introduction of the experts.
Thank you, Dr. Natasha. Well, first of all, I thank Almighty God, Vaheguruji, who have blessed us and showered energy in we all, that we are undertaking this type of international training program in a private veterinary college. Well, chief guest and the special guest of today's morning, I can say, Dr. Yatin Swinkels, the palm expert, the senior most and the elder veterinarian of the faculty members, students, interns, and the enrolled faculty, as well as the interns as the ambassadors of this training. I welcome you all for this international training on udder health and modern dairy practices, and today's workshop on the global aspect of mastitis, what are the challenges, how we are going to take that. Well, first of all, I thank the Netherlands government as well as the PAM organization for arranging the expert to our request, and thanks to the Khalsa College Charitable Society for allowing us this international training program to be organized in this very institution. Well, as has been explained by Dr. Narpalji, well, this is the organization that is quite old, and it is mainly supported by the government of Netherlands. That's a very small country, equal to the Punjab province, but it is denting the society all over the globe. And this organization has more than 1,000 experts in all the fields. You name the field, the expert, they will arrange the expert. They want to help the society globally, and most of the people are retired from their different departments, different organizations, and they are the senior. That's why they say senior palm experts, and there are more than 1,200 experts, and we already had such mission in when we were in PAU, Punjab Agriculture University, Ludhiana, then in Guru Angad Dev Veterinary Science University. We had many missions related to agriculture, horticulture, dairy, treatment, then color Doppler, hospital management, extension, nutrition, industry. I think it is maybe 30 or 30 plus, 31st or 32nd palm mission which I'm associated with that, and it has really resulted into excellent the working. The experts have improved the efficiency of the different organizations. That's why we again call them and help the industry, university, students, faculty, so that we are well trained in our field and can help the society, farmers, the pet owners, or the agriculture farmers, or the dairy or the other farmers. Well, the brief biodata of Dr. Yadin Swinkles. He graduated from the University of Utrecht in 1990, specialized in food animal science, and then he did his PhD later on from the GD Animal Health Service Institute, Deventer. Well, his skills and expertise is on dairy herd health, clinical research, udder health, milk quality, and he did his PhD on the mastitis. After graduation, he has 15 years of practice, mixed veterinary practices relating to large animals. Then in 2005, he was declared as a bovine herd health specialist by the Royal Dutch Veterinary Association. On the basis of that, he was picked up by the Intervet that has the headquarters in Netherlands, in Boxmeer at that time, and later on that is now known as MSD. He worked there for 15 years, and later on by this name, because it was owned by MSD, so the headquarters moved from Netherlands to the USA, and still he worked over there. And last year he retired from MSD. Now he is running his own consultancy, Swinkles Consultancy, helping the farmers. Now he joined the MSD as a global technical director in global ruminant business unit. That was the focus was the new product development, training, research mainly on udder health, but also on young stock throughout the world, how we can provide the better products to the farmers, to the veterinarians, so that they can help the sick animals. He has attended more than 9 World Butrex Congress. That is the biggest congress held on the globe that deals with the large animal, reproduction, nutrition management, and I think more than 5,000 veterinarians from all over the globe are attending that. From 2006 he is attending, and lastly he attended last year. Well, for your knowledge, the training profile is this training was started last week, and first he wanted to know what is the scenario of the dairy farms, how the farmers are maintaining the animals and their herds. Then we organized many visits to the dairy farms, mostly the HF, that is a big problem related with that. And then he suggested, he analyzed that farms and suggested the solutions to the farmers. Then we had in between have the lectures on the various aspects related to udder health. Then the sensors, management, nutrition, 5-point mastitis related issues. Today, now we are having the global aspects of mastitis workshop. Well, for your knowledge, the audience profile is we are having the veterinarians from the animal husbandry department. That is really in connect with the dairy farmers, grassroots level officers treating the sick animals, and the best from the faculty, from the university, as well as from the college, this KC was, interns, students, and that's the audience profile. I thank the PAM Netherlands and Mr. Yogesh, and that is the India representative PAM, who has helped us to bring this expert from Netherlands to here. Then I personally thank Dr. Suhinkal also. Then the Vice Chancellor Guru Angad Dev Veterinary Science University, Ludhiana, the Director Inspectorate, Punjab for deputing the veterinarians. Then the KCC was Khalsa College Charitable Society. Then the support of the faculty and the students, and the lucky faculty and the interns. And also I thank the dairy farmers who have allowed the visit to their farms. And once again, I welcome you all and welcome for this very important workshop on mastitis. Thank you, one and all.
The moment has come for which we all are waiting for. May I request our experts from Netherlands for the technical session, please.
Can you hear me? Yes. Good morning, everyone. Thank you for coming in such great numbers to this meeting. I'm honored to see you all, and I'm honored to be invited by the PUB to speak here. I came all the way from the Netherlands to help and to work together to make things better on the dairy farms. And I'm happy to be here, and I wanted to present to you about some global perspectives in the dairy business. I've been working all over the world for the last 15 years. I've been to dairy farms all over the world, and I think it's very interesting to be in India and to see what you guys are doing, and I'm learning also a lot from you. So I'm not only helping, but I'm also learning from you. Today we will talk about these global perspectives, and we will also go with mastitis treatment and control. Okay, I'll stand here. So as Dr. Verma said, I'm a Dutch veterinarian. I was in practice for 15 years and I worked globally in a big company, and I mainly worked on milk quality. Yeah, and milk quality I think is important in India because you have a vegetarian diet and you're dependent on milk, on animal protein via the milk. So I think milk is especially important in Europe. I'm from there. It's 8,000 kilometers from here. Individualistic, capitalistic. I think India is also rather capitalistic. We have a very direct communication, so we tend to be communicating things very directly. The culture is focused on efficiency. It's Christian, so that is different. But the majority of people are not going to church. So that has changed in the last 50 years. People are not going to church in Western Europe. And the hierarchy, what I see in India, hierarchy is very important. But in my country, it's not so important. So we call the boss of the company, we call his first name. And the father and the mother are just called with their first names. So there isn't a big difference between people in hierarchy. Of course there is a hierarchy, but we don't like it very much. And that is different in India, but I respect the differences, I understand them, and I need to try and understand them to be able to help. So this is a typical countryside picture in my country. The grass is growing very well because it's not hot, it's raining a lot, so that's why the grass is always green. And cows are on pasture. Yeah. So this is the typical picture. In the background you see the farm, and we have family farms with on average 100 cows. So here you see me as a young veterinarian in a typical Dutch herd, and looking at the data of the herd to see how the cows are doing. This is my team in the US. So I was in the company I was working for was in the US, and I had to go there 4 or 5 times per year, but they allowed me to work from the Netherlands. So when I came here, I'm used to the cow on the right, the Holstein Friesian, but here in India we deal with different species. We deal with the Bos indicus, not with the Bos taurus, and we deal with the buffalo. And I heard last week that India wants to slowly go to the Holstein Friesian, because the Holstein Friesian gives more milk. But I think it's not so easy. It's not like buying a Holstein Friesian and then milk it and that's it. The Holstein Friesians are very sensitive to disease. They're very sensitive to mastitis, they're very sensitive to lameness, and they are not able to stand the heat. They suffer from heat stress. Their comfort zone in temperature is from -5 to 15 degrees. Yeah, so that's their comfort zone. So when the temperature goes above 20, they are already getting a bit stressed. So it's not as easy as having these animals and then we have more milk, because they need to be in a perfect situation. They need to be having high cow comfort, a soft bedding, good ventilation, enough space, perfect nutrition. And if we don't provide that, the milk will never come out. Yeah, so we have a cow that can potentially give a lot of milk, but if we don't put it in the right environment, the milk is not going to come out. And your local breeds, they don't suffer from all these negative diseases. They are resistant to heat stress. They are resistant. They are not much more resistant to mastitis. So there is a big difference. It's not as easy to switch cow and then to think, okay, now I have more milk. But I'm here in the country, the world champion of milk production. Yeah, so India is the biggest milk producer in the world. That's why I'm so interested in coming here. And you have the future. The future of milk production is in India. There's a huge potential here to produce even more, and you are going to produce more. Because India, most farms are in India, in the world, 70 million farms. Numbers are from 5 years ago. In Europe, we're only having 1 million farms. But the farms in Europe are bigger. And here the farms are small. That's also why you have a lot of farms. But if your farms are getting bigger, then you're going to produce huge amounts. Also, don't know if this pointer works. This is the amount of milk a country is producing in million tons. These are the countries. I don't know if you can read it, but India is here. So you see India produces the most milk. What is it? 225 million tons. And in 2034, so that is in 10 years, the prediction is you're going to increase with 100 million tons more. So that is quite impressive. And that is the biggest increase of all the countries in the world. And you see Europe is even going slightly down. So it's not going to produce more. However, the milk production at this point here is relatively low. It's only 2,000 to 3,000 liters of milk on average. While in Europe, whereas Europe here is 8,000 or 9,000 liters per lactation. So that's a big difference. India is the star in milk production in the world. It's going to have, this is the number of farms, this is the increase in the next 10 years. It's going to have more farms, and the milk production is going to go up. You see the same thing happening in Pakistan, although their milk production is not going up as much as India. And you see Europe is going down, the number of farms will go down. We reach the maximum. We reach the maximum from an ecological point of view. We are producing too much manure and we are polluting the environment, and that is why, and also economical borders, we are going down a little bit. So India is the star in the world in milk production, and also in the future. But you guys are also drinking a lot of milk. The blue bars, here's India, is how much milk a country is drinking per person. That is around 25 kilograms fat and protein from milk. Pakistan is even bigger. I didn't know that, I was surprised, but you guys are drinking a lot of milk. So see, in Europe and US, we are eating more cheese and more processed milk products. But India is the leader also in consumption, so in production and in consumption. But this is the world. The red dots are the countries that do not produce less than the people want to drink, and the green parts are the countries that produce more than the people want to drink. So still, because you are producing so much, still you need more. You're minus 8.5%. And that's going to be in 2040, so that's 15 years from now. You're still increasing, but still people want more. This means that the milk will go from Europe or US to India. So there is a big need for milk in India in the next 15 years. And that's a global, the global demand for milk will increase to 50% in 2050, from the next 30 years. That means almost 500 million tons will need to be produced more globally, and that's 4.5 times the production in the US. So that's a huge amount that we need to produce more. And we're going to have less cows, and the production per cow will increase, will almost double in the next 15 years. We're going to have more trade, and there's going to be more milk consumption. So just to depict the future of the dairy globally. There will be in 2024, we are here, so this is 2024, and this is 0. This means this is the world milk balance. So it's the milk produced and the world milk that is consumed. At the moment we are at 0, so the amount of milk that's currently produced in the world is more or less what we consume. But in 2040, we will have a shortage of milk in the world of 12 million tons. So the world is not able to produce enough milk for what we need. And that is why I think, I go back, that is why I think the milk price is going to increase. Because when the demand is bigger than the production, then the price will going to increase. So that also means, if it is true that the milk price will go up, that means that that's a good sign. So it means the future of milk production is bright. There's a big need, and the price will go up. Yeah, but we need to produce more milk. It's not so easy to do that. Yeah, so how do we do that? More farms, more production per cow, switch to Holsteins. Is that how we need to do that? Well, I think producing more milk is one of the global challenges. Yeah. The second challenge globally is labor. Now in India you have enough labor. There is a sufficient amount of labor. But in Western Europe, US, a lot of parts in the world, there is a big shortage of labor. Antibiotic resistance is a big problem worldwide. We're needing diagnostics, especially cow-side diagnostics. We need to improve animal welfare. We need to reduce greenhouse gas emissions, and we need to do something about climate change. Those are the 7 biggest global challenges in the dairy. So to produce more milk, of course, we need to control all the infectious diseases. I know you're having a lot of trouble with brucellosis, foot and mouth disease. You're having these big infectious diseases. But theoretically, you can control those. Western Europe or the US is free of foot and mouth disease. And we are not better than you. So it is possible to get rid of those diseases. I know it's not easy. I know that you cannot, I know the cow has a special position in your culture. And what we do with how eradicating diseases is when they are infected, we kill them, or we bring them to the slaughterhouse, and this is not possible in India. So in India this is more difficult, but theoretically and scientifically this is possible. But mastitis you cannot eradicate, and it costs a lot of milk. From what I looked in the literature about mastitis in India, and I saw in Punjab there is what is it? 36% subclinical mastitis, and 9% clinical. I don't know if that is correct, but the general picture in the whole of India is that subclinical mastitis is more important than clinical mastitis. Yeah? So this is an overview of papers that are out there about India. Subclinical mastitis, or this is clinical mastitis, a big variation. The majority, clinical mastitis, is around 10%. There's one exception here in this paper, but generally it is more or less around 10%. And if we look at about subclinical mastitis, this is much bigger. So I think out of the literature and what I've seen on the farm, subclinical mastitis is your biggest issue. Now, mastitis costs a lot of milk, and this is if you see mastitis in this pie, subclinical mastitis is the biggest chunk. These are data from Canada. Subclinical mastitis is a big cost. Then clinical mastitis is also a big cost, and then these costs are preventive measures, the cost of preventive measures. If we look at subclinical mastitis, why is it so expensive? Well, it costs milk. Loss of milk production is 75% of the cost of subclinical mastitis. It's not the treatment, it's not the labor, it's milk production loss. Same with clinical mastitis. The majority is discarding milk and loss of milk, and also mortality. Yeah, so that is the biggest cost of mastitis. And because we need milk also, especially in India, this is something we need to do something about. So I said, now I asked the farmer, when are you happy with mastitis? He said, okay, if I have 0%, if I have no mastitis. But this is not possible. You can eradicate foot and mouth, you can eradicate brucellosis, but you cannot eradicate mastitis. It's impossible. You will always have it, so you need to control it. And then the farmer is asking for mastitis, doctor, do you have something stronger? Yeah, and what I learned in the last week, you are very focused on the cure of mastitis. But the cure of mastitis is very disappointing. Those contagious mastitis pathogens that you predominantly have, they know where to hide in the udder. They go intercellular, they go form biofilms, so the antibiotic can never kill them. And they have a smart strategy of surviving in the udder. And the antibiotic is not going to eradicate them at all. So the answer should be, yes, I have something stronger, prevention. Prevention is much stronger than cure. And it's difficult. Prevention, there's a human bias that prevention is invisible, so we tend to focus on cure. But if we want to control mastitis, and this is the pyramid of controlling mastitis, the basement of the pyramid is mastitis prevention and is preventive mastitis management. Only the second priority is antibiotic treatment. Yes, mastitis will occur, you cannot avoid it, but when it occurs, we need to treat it. But we need to treat it as early as possible, and related to subclinical mastitis, the best moment to treat it is at dry off, because we have no withdrawal time, and the rates at dry off are higher, are almost double than those during lactation. And then, if the subclinical mastitis becomes clinical, yes, we need to treat those cows. They are in pain, they are inflamed, they are sick, so we need to do something about it. But this is only the last priority. So the highest priority is the prevention. But to switch farmers from curing to prevention, we need to change behavior. Now, I had my own vet practice. Changing behavior of people is one of the most difficult things to do. Yeah? But as a veterinarian, this is an important skill. We need, as veterinarians, we need to change behavior of people. Because making cows healthy is not about cows, it's about people. It's how people are managing their animals. And we have a lot of experience with that in my country. What do you need to change behavior from cure to prevention? You need regulations. We need penalties. The milk companies need to say if you are above 200,000 cells per milliliter, you get a penalty, you get a lower price. This is really effective. We need education. We need social pressure. So it's very important. Farmers are very sensitive to what other farmers are doing. So if you have a very good farmer, and that farmer, if we make it an example for all the others, this is really effective. If one is missing, you're not going to be successful. If there's no regulations, it's not going to work. If there's no education and the rest is there, it's not going to work. So everything needs to be there to be successful. So, if subclinical mastitis is the biggest issue, if we need to produce more milk, if prevention is the strongest medicine we have, then I think in India we deal with the 5-point plan. And I probably, you are aware of this, I think you are, the milking machine needs to be functioning and need to be checked. The milking procedure and hygiene need to be very good. Treatment of clinical mastitis needs to be done. That needs to be done properly. All cows need to get antibiotics at dry off. And I know culling is an issue in India, but then you can separate the cow and milk it last, and then it cannot infect the other cows. Yeah, so those are the 5 most important points that you should remember. If I wake you up in the middle of the night, what is the 5-point plan? And then you know, this is it. So, I have 7 questions for you here. I'm going to read them to you, and then I'm going to ask you how many you are going to answer with yes on most of your farms. Yeah? So the first question, is the milking parlor looking clean and tidy? The second question, is the milking cluster and the rubbers, are they clean? Is the milking machine function checked 1 time per year? And if it's not functioning, is it corrected? Is the vacuum level according to recommendations? Is the milking machine clean and disinfected after each milking? Are the rubber parts in good shape? No cracks? And other liners replaced after 2,500 milkings? Now I want to ask you, with most of your farmers, are you able to answer who is able to answer all these 7 questions with yes? Nobody? Okay, who is able to answer all these questions with yes on 4, 5, or 6 of these questions? Okay, nobody. Who's able to answer for most of the farmers with yes 2, 3, or 4 questions? Okay, still no? Yeah, okay. And who's able to answer 1 question with yes? So that means that we're not able to answer the questions with yes. So if that is the case, this is your focus. Here's your focus. And by the way, if you have any questions, please ask. Yeah, you don't need to be silent. I will encourage you to ask me questions and challenge me if you disagree with me, or if you think differently, or if you have a remark or you have a question. Please feel free to ask. Okay, but if this is the case, maybe you're shy, or if this is the case that you're not able to answer all these questions with yes, then we have a big problem in India. Yeah, I know most farmers are milking by hand, I know that. But still, if they have a milking machine, they should be answering all these questions with yes. Okay, teat swelling and teat keratosis is a big problem with milking machines. Teat end keratosis, if you see this here, this damaging, it's a score 4, it's a very rough teat end keratosis. Or you see this, score 3 or 4. This means over milking. It means that the vacuum is high, the cows are milked, and there's no milk coming. Then the teats are damaged. This causes mastitis a lot. Do you see hardened or blue teats in less than 10% of the cows? Is swelling at the teat base visible in less than 10% of the cows? If you answer all these questions with yes, who's able to answer for most of your farms all these questions with yes? You see less than 10% of cows with teat end keratosis. You see no hardened or blue teats, or do you see swelling at the teat base after milking? No, you don't see it? Okay, that's a good sign. Thank you for that. If that is the case, then this is important. You can see, everybody can see this during milking. I know this is maybe the most usual picture in India, correct? So what is the biggest mistake here that you see here? So one of the most effective and cheap things to do is to wear gloves during milking. And gloves cost nothing. But they prevent infection very effectively. So it's because our skin can have huge amounts of Staph aureus. Our skin is a very rough surface. Staph aureus loves to survive on our skin. Strep agalactiae as well. They love our skin. But if we put on gloves, they don't like it. And they don't survive. And they are, when you're wearing gloves, the number of bacteria is going to decrease hugely. Yeah? And that is very important and costs almost nothing. And also your hands keep soft. After milking, the farmer hands stay soft. And people like that as well. Yeah? So everybody can do this. You don't need much. This should be the standard in India. If you want to be the future leader in milk production, if you want to produce more milk, this is a simple thing to do. Teat end disinfection. This is one of the most economical things you can do to prevent mastitis. It's not difficult. It doesn't cost much time. Yes, the disinfectant costs a little bit of money, but I think this is very, very effective. So, another 7 questions for you. Is the milker wearing gloves? Are the teats disinfected after milking? We talked about that. Yes. Is the milker using 1 towel per cow to prepare? Yes? Okay. Are teats properly disinfected with a proven effective disinfectant? Yes. Is the time between cluster attachment and milking 60 to 90 seconds? Yes. Yes? Very good. Is air prevented from entering the cluster? Do we hear that air sucking all the time during milking? Yes. If you hear the air sucking, it means mastitis is spreading everywhere. Yeah, so we don't need to hear that. Is the cluster taken off early enough? Farmers want to milk the cows completely empty. They want everything out of the udder, so the milking machine keeps going, even when there's no milk coming. But then we are damaging the teats. We are causing mastitis. Yeah, so the milking speed at which the milk cluster should be taken off should be more than 300 milliliters per minute. So it's not a problem when there's 1 liter left behind in the udder, because it will come the next milking. So the udder does not have to be completely empty. So these are questions that should all be answered with yes. If they're not all answered with yes, you have a problem. You're not preventing mastitis effectively. So we said produce more milk, labor. We said produce more milk, yeah? We're still talking about that. So the message is prevent mastitis, you will have much more milk. The second challenge is labor. Produce more milk. We need to innovate. Instead of antibiotics, we need vaccines. And there are vaccines on the market in the world, but they are not always that effective, and they are expensive. Most mastitis vaccines you need to inject 3 times per lactation, and I think with management you can achieve the same thing as vaccines. But there's still a lot of people in Western Europe that use the mastitis vaccines. I don't know if they are on the market in India, but I think it's something for the future, but that will come. We will use less antibiotics and we'll use more vaccines. Because vaccines are preventive. Yeah? We need genetics. We need cows that are not sensitive to mastitis. And that is selecting for the shape of the udder, the length of the teats, the depth of the udder is all very important. They're all risk factors for mastitis. So genetics is very important. And then training, education, we talked about that. It's one of the most important things. So if we want to produce milk, less mastitis, but also have more vaccines, better genetics, and better training. Labor in the world is a big issue. I'm saying not in India, but if you go out of India and you come to my world, what we see is dairy farms are going automatic. Everything is going automatic. And we see automatic milking machines. So the cows decide for themselves when they want to be milked. They go in a robot, they go in here, and they are going to be milked automatically. Even you have parlors, these parlors that turn around slowly, and everything goes automatic. This is increasing. We see feeding goes automatic. Nobody's feeding the cows. The feed goes in here, and this machine is feeding the cows automatically. We have automatic machines that push the feed to the feed fence. So everything is developed to reduce labor. We have sensors on cows. We have sensors. We have the pedometer. We have sensors here. And then we can monitor the behavior of the cows on the screen. So then we don't need to go to the barn every time. We just look in the screen what cows are sick. So automation of disease detection is also happening. And this is the future. This is the future of dairy, is automation, because of the lack of labor. Antibiotic resistance is a big problem in the world and is costing many lives in humans and also in animals, but the biggest problem is in humans. So there's been some research, and it has been shown that the more antibiotic a country is using, the more antibiotic resistance. there is. So antibiotic resistance is linearly related with antibiotic use. And when this research was done, the Netherlands in Europe was using a lot of antibiotics, together with Belgium, and you saw that this is the antimicrobial resistance, and this is the antibiotic used, and you see it's a straight line. Now this is the quantity of veterinary antibiotics used in the world. So you see who's the winner is China. China is the winner because they have 1 billion pigs. They have 50% of all pigs in the world are in China. So they are using huge amounts of antibiotics. But India is also using a lot. You see that? It's not, by far not as big as China, but still, it's the bigger the circle, the more antibiotics are used. Yeah, so the bigger the circle, and India is not compared to China, but still, it's relatively big. So I looked this up on the internet. This is the amount of death in human beings in India per year due to antibiotic resistance. And we're now 2025, and we are at 1 million deaths per year because infections, urinary infections or respiratory infections, cannot be treated because the bacteria are resistant. And this is the trend towards 2050. It's going to double to 2 million per year. Yeah, so in humans, we're having a lot of people being killed because of antimicrobial resistance. Now the question is, what is the contribution of animal health? What is the contribution of antibiotic use in animals to this? And that is not clear. That is one of the issues, is that we don't know for sure how, with a few exceptions, how the antibiotic use in animal health is contributing to antimicrobial resistance in humans. And in my country, we use the precautionary principle, which means that suppose this is true, that we are contributing to so many deaths in humans, we need to reduce antibiotics anyway. Yeah? And this is what happened in my country. So this is the antibiotic use. This is the Netherlands. This is the antibiotic use in 2009, 2010, 2011. This is pigs, poultry, all species. And the government said you need to reduce antibiotics by 50% in the next 5 years. Yeah, so there was a regulation. And all vets in the country were being checked. The farmers were being checked. And everybody said, this is not possible. This you cannot do this. This is not possible. So we took 2013, what is it, 2013? No, sorry, 2009 as the reference year and said, now we are at 100%. 2009 was 100%, and from there we need to reduce by 50%. And this is what happened. We went 80% in 2012. Then we went to already to 50% in 2014. So indeed, 5 years later, we reduced antibiotics with 50%. Then it went down even further, reduction with 60%. And then in 2025, we have a reduction of antibiotic use of 70%. So maybe everybody in the room here says this is not possible, but it did not cause any animal suffering. There were no cows dying from this. It's just that the management, the prevention of disease improved. Because the government was forcing us to reduce antibiotics, we had to improve management. This proves that antibiotics are used to cover up bad management. Yeah, so this, and if we can reduce this by 70%, you can do it as well. You're not we're not better than India in any sense. So it's just an example that it is possible to reduce antibiotics in an enormous amount. If we look at mastitis, reduction in antibiotics, how do we do that? Maybe you also say it's not possible to reduce 50%. I hear you think this is not possible. We cannot do this. But most mastitis cases, we only need to treat intermammary. We don't need the parenteral injection in the neck, only in very sick cows. Number one. Number two, we only need to treat for 2 or 3 days. Most cases don't need the 5, 6, 7, 8, 9, 10 days treatment. Dry cow, if the cell count is low, if you have been able to manage the subclinical mastitis, not all cows that dry off need antibiotics. Maybe you're still in the stage that all cows need, you're now in the stage that all cows need antibiotics, but if you have controlled subclinical mastitis, you can go and reduce. We are saying that not all clinical cases need antibiotics. Yeah, so these are 4 factors how you can reduce antibiotics. Oops. So the injection in the neck is only needed to protect the cow. So when the bacteria are going from the udder to the cow, when cows are very sick, in fresh cows, high milk production, they have very systemic signs of disease, high fever, cows are not eating, are lying down, they need the injection in the neck because we're then treating the cow. Yeah? But most cases, this is only 5% or maybe 10% of mastitis. The 90% doesn't need the injection. There's no proof. There's no science that says that this is better. So when the science says that the parenteral treatment is not better most of the time, we should not be doing it. Yeah? When we treat clinical mastitis, we usually treat it same for 5, 6 days. And the main reason is that we treat mastitis as long as we see clinical signs. We want to do a good job. We want to save the animal. We want to bring it back to production. And here you see the research says when the line goes down, it means that signs are disappearing, and you see after 5 or 6 days, most cows have no clinical signs left. So we tend to treat, but we forget that the bacteria are already dead at day 2 or day 3. It's just that the inflammation has to come out for the next 3 or 4 days, and then we think, oh, the cow still has mastitis, but the bacteria are already dead. So I did research in my PhD. I interviewed 21 farmers. Here's an example from Germany. I interviewed them, and they were all treating clinical mastitis up to 5 days. But the label on the drug said, on the intermammary drug said, you need to treat for 2 days. But they were all treating 5 days. So it was all off-label treatment. And the most important reason the farmers said they were doing this, and they were saying, yes, but we treat as long as we see clinical signs. Yes, so I interviewed 21 farmers, they all said the same thing. We treat as long as we see clinical signs. So this is published in the Journal of Dairy Science, why farmers are doing this, why farmers are treating for longer than is needed. So another research that I did was I compared standard treatment, which is 2 days, to 5 days treatment. So for E. coli, this is the cure rate. You see there's no difference. For Staph aureus, there's no difference in treating it 2 days or 5 days. Not any difference in bacteriological cure. If we look the Streptococci, yes, they were curing at a higher rate when we treated for 5 days. So it's not always, sometimes we need to treat for longer. It's not always the same. And then the other bacteria, it made no difference. And then on average, when you would not know the bacteria, treating for 5 days was not any better. And look at when we didn't treat them, the cure rate was 0%, but when we treated them with antibiotics, 58%. So this cure rate is not so high, but still it's much better than doing nothing. So it means that the gram positives are the ones that profit from antibiotics, although their cure rate are not going to be very high. So selective mastitis treatment is upcoming in the Western world. It means that we're not treating gram-negatives mastitis any longer. So what we do is we take a rapid diagnostic test, a cow side test, which could be a gram test. We just do a gram staining test. Then after 24 hours we know the outcome. And then if it's gram negative, we simply don't treat it. If it's gram positive and we think there's a good probability of cure in that cow, we treat it with antibiotics. So this way you reduce antibiotic use by 50%, at least when you have a lot of gram negatives. This is a way to reduce antibiotic use. And this is upcoming everywhere. So there's also research that says with the chronic subclinicals, you can select the right cow for treatment. So we know for Staph aureus that cow factors that are related to lower cure is higher age, fresh cows, high somatic cell count level, hindquarter, and penicillin resistance. So if I have an old cow that is fresh, so less than 60 days in lactation, that has more than cells than 500,000, infected in the hindquarter, and is penicillin resistant, don't treat it. But if I have a cow to the contrary that is young, is late in lactation, has a relatively low somatic cell count between 2 and 5 resistance, but there is a proven effect in NSAIDs with moderate and severe mastitis, but there's no data on mild mastitis. So there's no data, no proof that NSAIDs have an effect when we see a few flocks in the milk. There's only clinical effect, there's no effect on the bacteriological cure. It reduces fever, pain, and we need to treat it early in the infection. If there's a chronic infection, the NSAID will not really do something. It's too late in the inflammatory cascade. Yeah? Okay, antibiotic trical therapy. I heard this is not the standard in India, but this is, if you're going to do this, this is very effective against subclinical mastitis. This is has been the cornerstone in the world to control subclinical mastitis. So together with all the questions I had on milking and on milking hygiene, this is very important as well to control subclinical mastitis. And what does the antibiotic do? It cures existing infections and it prevents new infections. So this is from a meta-analysis. I think 30 studies were included. And what can we expect from antibiotics that dry off? A cure rate of subclinical mastitis of almost 80%. This is very effective. We're never going to have this during lactation. But if we do nothing, there's still also a cure rate of 45, 46%. So, but still, this difference is significant. Antibiotics at dry off also have a preventive effect. This is very important because look where most new infections occur. This is the rate of new infection. This is the dry period. This is lactation. There's two peaks. That's at the involution period, just after stopping milking, and at the beginning of calving, then we see huge amounts of bacteria going into the udder. We don't see mastitis at that time, but the mastitis then comes out in the first week after calving. So you get a peak in fresh cows. So the red line is the heifers, is the young cows, and the yellow line is the cows. Yeah? So if we don't control the dry period very well, then we get a peak directly after calving. And this is research. This is the monthly lactation, and this is the amount of clinical mastitis. The red bars are the infections acquired during lactation, and the blue bars are the infections acquired during the dry period. And you see that, oops, what is this? This means that when we have a lot of clinical mastitis in fresh cows, they come from the dry period. So that's also why dry cow therapy is so important, because we prevent the clinical mastitis in the first 60 days, first 100 days of lactation. Yeah? So here you see the blue bars are bigger than the red bars, means that in the first 100 days, most clinical mastitis cases have their origin in the dry period. 65% bitumen subnitrate, you put it in the udder at dry off, and it prevents new infections coming into the udder. And this is very effective, that's why everybody is using that. There's no milk withdrawal, and you need to milk it out at calving. It stays in the udder until calving. It stays in the udder for 100 days, at least. Sorry? It is in the teat. It stays in the teat, but I have to say sometimes it's also leaking to the udder. Yeah? I think this happens a lot, but still, if that goes to the udder, still half of it will stay here and it will be affected. So the leakage to the udder is not a problem. That has been studied. So how to do that? You treat with antibiotic first. You put it in the udder, you massage the antibiotic into the udder. Then you pinch the teat base with your 2 fingers. You close it here at the base, and then you put in the teat sealant. First the antibiotic, then the teat sealant. But putting the teat sealant at dry off is very dangerous. We can put in, many cows have died from this because the teat sealant has no antibiotic. It does not protect against infection, and you can bring in bacteria very easily. So that's why you need to be very hygienic in cleaning the teat, and especially the teat end. And you need to do that twice. Yes, you disinfect the teat, you focus on teat end, wait for 30 seconds, and then you do it again. Then you put in the teat sealant. So how effective are teat sealants? So normally the new infections in the dry period, when we don't put a teat sealant, is 30%. And when we put in the teat sealant, it's only 10%. So that is around a 70% reduction. So it's a 2/3 reduction, 70% reduction is very, very effective. Yes, there is also external teat sealants, but nobody is using them because it is a problem, because they do not stay for long, they get damaged, and cow's calving, sometimes you really need to do effort to remove it, and they are abandoned. The external teat sealants, so that's a plastic thing around the teat, but that is abandoned, and I think nobody is using that anymore. So that's a good question. Thank you for asking. Anyone else has a question, feel free. Don't be shy. Don't be shy. So, this is the reduction of infections. So the teat sealant, internal teat sealant, is better in preventing infections than the antibiotics. So this is the internal teat sealant reduction of infection by 70%. But when I add a teat sealant to that, it's even going to reduce further. It's going to be 25% better than only the antibiotic. So the teat sealant reduces clinical mastitis in the next lactation with 50%. Yeah? So, and if I use it in addition to antibiotics, it's even better than antibiotic. It reduces clinical mastitis 29% more than an antibiotic alone. So when to use antibiotic and when teat sealant? When your bulk tank somatic cell count, so that's the cell count of all the cows on average, is bigger than 300,000, then you should use antibiotic in all quarters. If you don't use antibiotics, I would encourage you to do that because it has a big effect in the control of subclinical mastitis. But when the bulk tank is low, below 300 or below 200, we can only treat the start using antibiotics in all quarters. Yeah, and only then if you are answering all the questions that I posed. Yes, you're using antibiotics here and reduce the cell count, then you can start with teaching. So it's the next step. Okay, the next challenge is, the global challenge is diagnostics. When we have a mastitis, we want to take samples, the laboratories are too far away. And laboratories need to be well equipped to do that. And also we have a lack of reliable, low-cost cow-side diagnostics. Especially point number 3 is really an issue. Yes, we have the CMT test, but the interpretation of the CMT test is somewhat subjective. The question sometimes is this positive? Is this positive or not? Sometimes there is a trace, yes, no. So it's somewhat subjective. And we have a scoring system. Score 0 when there's no viscosity change. Score 1 when there is a little bit of gelling. Score 2 when there's a clear gelling, and score 3 when there's extreme gelling. But we also have a score in between here where we see there's a trace of gelling. And this is the problem with the CMT when there's no reaction, when it is negative, still 25% is infected. So it means 25% false negative. Then when we have a trace, we think, okay, it's in between positive and negative, 50% is infected. When we see it's positive, then the more clear the CMT test becomes positive, then we know the CMT test is reliable. It's only reliable when there's a clear response. But in this early phase, here is the weakness of the CMT test. And we are lacking a better test that we can use cow-side. Animal welfare. So I know that culturally in India you're taking good care of cows, it's in your system. But still, having good nutrition, having good housing is not so easy. In Europe and in the US and everywhere, this is a big thing. The consumers of milk are starting to be critical at the farmers and saying, you cannot treat cows like this. And the future is going to be that we're no longer allowed in Europe to keep cows individually. because we have new research saying that if you keep calves in pairs, they do much better. They do much better because they learn from each other. So because the research is so clear that keeping calves together has a good result, this is going to happen in the next 10 years. I think every farmer will have cows, not have the calves separately housed. But also consumers are saying you have to keep the calf with the mother all the time. And the farmers don't like that because it's not practical. And this has a big impact on the way we are farming. But the consumers are saying this is not ethical. This is stress for the calf, stress for the cow. And this is a big debate in society that we should not be having cows alone and separated from the mother immediately, but we should keep them with the cow. This is a national debate. Yeah, the weaning is done. This is just immediately after calving. This is just the first 4 weeks. Just for 4 weeks. You keep them with the cow. And then weaning and calf with the mother. Yeah, they don't like it. To keep the calf with the cow. Yeah. Check. No, this not anymore. Right. So at the end, if you have enough food, the consumer starts to be critical. Yeah. Also, agriculture is put under pressure to reduce its greenhouse gas emissions. And if you want to reduce the greenhouse gas emissions per liter of milk, we need to increase the production. Because then we need more concentrate, and then that way we will reduce. That's the first thing you need, I think, to do in India to increase the production per cow, and then the greenhouse gas emissions per liter of milk will go down dramatically. Outside India, we are also becoming more vegetarians, and it's because the consumers are so critical. They say we don't need milk. We just eat plant